Good morning, Mick. Lovely to see you this morning. Thank you for your time. Now, I found out about you through the I Wish It Was Cancer, the experience of pulmonary fibrosis in the UK, which was a recent report that came out, and you were involved in that report. And when I read it, I was really surprised by some of the figures of people living with pulmonary fibrosis. And I was very kindly put in contact with you by a lady in Cambridge and Peterborough, which has been great. So I'd love to hear, tell us a little bit about yourself, Mick.
Right. Well, I was born in Harlow, and I became a IT initially programmer and then consultant, and worked freelance, even had my own company for a bit, and alongside that got married quite a long time ago, sort of 40 years, and have 2 children, a son and a daughter, and so far 3 grandsons who are aged between 4 and 6.
I'm sure they keep you very busy then.
Yeah, I can't keep up with them anymore.
Oh. So how did you get involved in the report then?
Well, I got diagnosed three years ago, and I've got something I can say about that as well. But I can't quite remember exactly, but I think now that I belong to several support groups, and one of them was St George's support group in London. These are all, because you can do everything online now, it's very useful, and they've got quite close links with APF, which is the charity that commissioned this report. And they had a healthcare consultant who ran workshops and interviews. Well, I had an interview with this lady called Sue, and I think she was quite shocked, and I think she was becoming more and more shocked at the sorts of information she was gathering from other people as well. And I sort of said to her, well, you know, if you need me to do any little jobs, I'm happy to do that. And so on occasions I gave suggestions about some of the things that were coming out of it, but very, very small amount really. I was just there in if she needed something, I'd try and, or qualifying something, I'd try and do that. I didn't really didn't write any of this apart from the foreword. That's how I got involved with it.
But it's great that you were, because it's so important to have the patient voice in these reports and for us to understand what it's like living with it. So how are you managing on a day-to-day? What's it like living with idiopathic pulmonary fibrosis?
As I said, I got diagnosed 3 years ago. The first year and 3/4 are no different. I was still pretty fit, still walking 4 miles a day with my wife. We'd always walked. I could walk much further than that, even then, 10 miles or more when we were on holiday. The last year I've declined, and started, the decline really necessitated me being on a condenser, oxygen condenser, for for walking and exertion. That became inadequate towards the end of last year. I was on max and it wasn't giving me enough. So I'm now on condensed oxygen cylinders, and my walking ability is now, I don't know actually, 400 yards at the moment. So massive hit. Day to day, the symptoms that are outlined in the report, lots of people have them, but you know, the morning for me is particularly bad. So I don't need oxygen overnight, and I don't really need oxygen when I'm just sitting in a chair watching television. I'm wearing it now because I get tired quite quickly, and that makes me cough. But in the morning, I'll wake up and I have to get water and my oxygen 6 feet across the floor to my toilet, so that I can sit on the toilet, because otherwise I'd simply fall over with coughing. So the first 20 minutes of my day is breathlessness to the point, on occasions, I'm almost retching. I need to be able to sit there, have oxygen, have the occasional sip of water, clear my throat, because you get a massive amount of sputum. Now mine's not as bad as many people's, but it's this last 20 minutes, and at the end you feel your throat's sore, your chest feels like you've been punched or whatever, because that's sore. Your stomach's sore because the muscles in it are strained. But gradually, go downstairs, have a cup of coffee. I start to feel better. But it's got to the stage now where my wife, and I don't know how people who have not got someone who loves them to care for them survive, actually. But my wife helps dress me now, which 4 weeks ago didn't happen. I was completely able to do that myself. So I have coughing fits during the day, but I feel breathless during the day. I'm okay in the morning, much better in the morning than the afternoon, but tired. The tired accelerates until lunchtime, 1 o'clock, and then I need to go to bed for probably an hour and a half, and then I come back downstairs and do the best I can, but gradually feeling tighter and tighter again. And by the time I'm in bed by 9, because I simply haven't got the energy, and it's more comfortable. With this, you've not only got the loss of movement, the fact that because your body's not supplying enough oxygen, there's a strain on your heart, so my heart can be all over the place on occasions. I'm talking about pulse and palpitations, missing beats, yeah, and I just that's a side effect that a lot of people have. With the tiredness, obviously your heart can't cope properly, your muscles then haven't got enough energy, and your brain starts to miss tricks as well. So I'm starting to I'm not confused exactly, but things that I would have cottoned on easily to a couple of months ago, I don't understand it. So it has to be explained. And then I say, oh, that's funny, yeah. So I find the effect on my whole body, and it's not just, as I say, your lungs. It's on your whole body, and with that comes a psychological strain as well. So I've been very, very fortunate insofar as I've spoken to the talking therapists in Chesterton, in Cambridge, and they're two wonderful ladies who've listened to me, Afoma and Karen, and that is something that I think there's a lot of stigma attached to. So a lot of people don't do it, don't know how to go about doing it. But for me, it's been very important.
Thank you. Yeah, a sip of your water. So going back to the report, I know that you were really keen to talk about some of the elements and a bit, what would you like to see, having lived with it and being involved with the report? What is it that you'd like to see change, and how can we better support patients living with it?
Well, I think in first instance, because it's such a shock that you have a terminal diagnosis, and that your whole life is shattered in a way, that the first thing is you need to be taken seriously, and not just as a statistic. So my initial, I suppose, notification was via a telephone call, and I didn't understand it because I knew I had ILD. No, sorry, I knew I had interstitial lung disease. Yeah, I knew I had that, but I didn't realise that pulmonary fibrosis was the development from that. So when I went for a consultation, I didn't realise it was terminal. My wife wasn't allowed to attend that session, and so I was quite disturbed. I was quite disturbed at being told that what I'd got was terminal, and that was something 2 to 7 years, 5 to 7 if you were on medication, antifibrotics. Oh, and by the way, you don't qualify for antifibrotics. That's what I was told. And that not qualifying was down to NICE guidelines suggesting that you had to have a forced vital capacity of less than 80% to qualify. Now, That's not been true for me because my force vital capacity is still quite good, but my gas transfer is appalling, and that's what's doing me in really. So that measure doesn't seem to work for everyone, and what's more is even they don't believe it because they rescinded the qualifying measure. So anyone now who's diagnosed gets it. Pretty much immediately. They're getting nintedanib anyway. By the time I got given nintedanib, which is 7 months ago, it's pretty clear it doesn't work for me anyway because it's been left too late. So I think NICE really should be held to be accountable for that. But anyway, that's me. One of the other things that I think is really important is that you get provided with a proper amount of information when you get that diagnosis. I didn't get anything actually. I didn't get anything for another year when I had my next consultation. And even that wasn't in the form of a pamphlet or a file or anything like that. It was simply a doctor telling me what I should do. I.e., I should speak to the charity, APF. I should join support groups. The charity, when I spoke to them, told me that I should ask for a referral for pulmonary rehab. I didn't even know that existed, and like so many other things, I didn't know what existed and what didn't exist. So I think for me now, one of the most useful things was having been referred to the community respiratory team, who subsequently referred me to many other people, and that's been a sea change really. But I didn't know they existed either until I got a referral July last year.
Yes, I mean, from talking to you, I know you said that it's been a bit of a challenge sometimes to know where to go, and unfortunately we hear that with lots of different illnesses. So I think that's really useful to take away from people listening to this. It's that patient information is so vital, isn't it? For you to go away with nothing is really sad. So I do feel for you. So as we sort of draw to a close, is there anything that you'd like to, as I say, from the report or anything else that you'd like to see changed, having been living with it, that maybe the people that are listening to this webinar that would be able to help?
Well, I think I mentioned in my notes that this, when you get a terminal diagnosis, suddenly two things are really important. One is the time that you've got, and the other thing is the quality of your life. And neither of those aspects seems to me particularly important to consultants. As I say, you might as well be a piece of meat. It's not true of nurses. Nurses are much more aligned to those things, and I've had the good fortune, as I say, of being treated by the community respiratory team. So thank you, Gemma and Mandy. And from that, I've also been treated by the breathlessness, which has helped me, and also been referred to palliative care, but not permanently. The living well aspect of that. So I think that's really important, knowing what's there, what you can do about it, and I think it's really important to have a pathway. One didn't exist, I don't think, until quite recently, and I think that's one other aspect of the consultant who was writing this report. That came out of it, and I think that work was done with consultation with the NHS, and it's kind of important to know where you are and how far along you're likely to be. I know it's difficult because this people deteriorate with different patterns, so I know that's difficult, but it is important, I think.
Yes, I think that's a very good point, isn't it? It's having those discussions so that you understand where you are and that you can prepare. And that's what a lot of palliative care is about, is the advanced care planning and thinking ahead and planning for what's important for you. And if nobody has that conversation with you, it's very hard, isn't it, to then be able to start to plan.
Yeah, I think it is very hard.
Thank you very much for your time, Mick. It's very much appreciated, and thank you. As I say, I'm sure everybody will have really appreciated your time and listened to your story. So all the best. Thank you.
Thank you, Bev.